Everybody is ready for this panel. I am too. I think this panel is a good culmination of a lot of things that we've been speaking about today so far. This is really where we start to put a lot of the pieces together in a real-world situation, from the program, the implementation side, as well as the payment side and what that potentially looks like. And of course, all of that always involves some level of policy that helps facilitate all of those things kind of coming together. Sometimes we think of the policy as kind of the glue that binds all of these pieces. So this conversation, thank you for joining us today, and I'm going to have each of you briefly introduce yourselves, and then we'll start with our presentations from Emily and Lucia. So maybe, Charmeka, you want to introduce yourself first? Green is go.
Okay. Hi, everyone. My name is Charmeka Martin. I am a Stakeholder Engagement Director representing Healthy Blue in the state of Kansas under the Elevance Anthem umbrella. Nice to meet you guys.
Good afternoon. I'm Donna McClish, CEO of Common Ground Producers and Growers, Wichita, Kansas, mobile market.
You can keep yours. And then Emily.
And I'm Emily Brown, co-founder and CEO of Attane Health.
And then do we have Lucia?
Yes, can you guys hear me?
We can.
Okay, great. I cannot see anyone right now, so I don't know what you're seeing.
Well, you sound great.
I'm sorry. Okay, sound good. Okay. This is Lucia Jones. I'm the Associate Director for Social Determinants of Health and the Maternal Strategies for United Healthcare, one of the MCOs for the state of Kansas.
Excellent. Well, thank you again for joining us. The way that we're going to start is we're going to hear a little bit about the work that each of you are doing. You're both kind of paired in a project, Charmeka and Donna, and then Lucia and Emily. So we're going to start by getting a quick overview from Emily and Lucia of the project that you are involved with and kind of the different moving parts and pieces to that. So I'll hand it over to you.
That's great. Actually, I believe Lucia is going to start. I don't know if the slides.
I don't see the slides, but I kind of remember. I can get started, Emily, and if you see that my kind of what I'm talking about goes into the points, because I don't see the slides, so I don't know what is up there, but it's okay. Am I okay to start?
Yes.
Okay, so I have been blessed having the privilege to, oversee as I mentioned before, the social determinants of health and maternal strategies for our plan here in Kansas. For the past few years, we have been focusing on improving our health-related social needs and also in addressing the maternal and child health outcomes and closing disparity gaps. So I started working for United about almost 5 years ago. And part of that SDOH internal strategies was to have a person dedicated to focus on food access. And her name is Celia Ruiz. And I believe she's participating in this activity today. And so in that process of improving our internal programs, we connected with Jerry Jones, which is a dear friend of us, a colleague for Emily and I, and he mentioned Emily and he connected us. So I met with Emily, Celia and I met with Emily, and we learned about her product, the goals and the visions. And after sharing with our leadership, we decided that investing in this local partnership to bring support for our high-risk pregnancies was the right thing to do. So I don't know in which slide you are, but I'm going to share now with you what are the aims of the program. Do I just keep going? It's hard when I cannot see what is happening.
We have your title slide up. We're looking for aims, but you can go ahead and start.
That's fine. Okay. So we are, the goal of this project, or the aim of the project, is to support our high-risk pregnancies and ensure that we support them all around the state. with the understanding that many of our members are in rural and frontier areas, and these members usually face more issues related to food access. So the objectives of these partnerships are to improve access to nutritious food and improve, of course, maternal and birth outcomes and maternal and child outcomes. And we also would like to see if this type of support improves engagement and member experience, and that with the data that we are going to be able to collect through this partnership, that we can use this data to inform us as a payer, but also to use this information to inform policy. So I will pass this to Emily for her to describe a little bit more of what they do, what she does, and the partnership.
Great. Thanks, Lucia. As I said before, I'm Emily Brown, co-founder and CEO of Attane Health. And I just want to give a little bit of background about myself and why I started Attane Health before we jump into what we actually do in our partnership with Lucia and United Healthcare. So I come to this work with lived experience. For those who were in the room yesterday, you heard that it wasn't that long ago that I was on Medicaid here in Kansas, a mom with 2 sick children. And it was very difficult for us to find and afford the foods that we needed to keep them healthy. So initially, I started a community-based organization, a nonprofit, to get special dietary foods into food banks and food pantries. And as I did that work, I recognized not only the value of community-based relationships, but I saw the real challenges of scaling food as medicine interventions. And so I left the nonprofit, and Attane Health is a social impact venture that's focused on really driving the needle forward and providing consistent, high-quality access to foods to individuals who need it the most, and then providing that wraparound support and education to really drive outcomes. So working with Lucia and United Healthcare in the Maternal Health Project is really key and foundational to the work that we do at Attane Health. And so we have a platform that allows members to come on through a short onboarding process. They're able to select the foods that they need and want that meet their dietary requirements, and then we deliver them direct to their door. And so this approach is unique in that we've done all the difficult, hard work for making it easy for individuals to determine which foods are best for them. So we've tagged and added filters so they can search through allergens, ingredients, certifications that are important to all consumers, as well as diets and lifestyles like diabetes and hypertension. And those algorithms that allow individuals to select those foods were developed by a registered dietitian. So we've made it very simple, but really have this approach of meeting individuals where they are and empowering them to make better choices over time and taking in consideration cultural and taste preferences. And so this project is really, really important because we know that these members of United Healthcare live all across the state of Kansas. And so eliminating those transportation barriers is key. And so we work with a network of supply chain partners, and we're able to offer high quality foods. We have around 900 items on the platform across grocery categories, including fresh produce. And then we deliver that direct to their door. So even if they live in a community where that retail infrastructure does not exist, we're able to offer them the same high quality experience that a member living in an urban setting might also have. I think it's also important to note that there's another member of our team who's missing, and that is our team lead from Altruism Media, which is a community-based organization that is focused on supporting individuals prenatal and postpartum in Kansas and Missouri, and has deep experience in rural communities. And so they are a very important part of our project because they support that community engagement. And we know how important community-based organizations are, and it's their connection to community. And so once individuals come onto the platform, they're able to shop, we deliver that service, and then we provide high-quality data and insights back to the payer, not only on that utilization, but consumer shopping behavior. And then we also support the members with one-on-one coaching to really make it applicable. And so, yes, yes, that'd be helpful.
It's a trick we're doing. Develop slides, but then we're not going to show them to you. Really test how much you developed this presentation.
And so I want to talk a little bit about the benefit. I believe that's where we are in our presentation. We talked about the objectives. And so just an overview of the benefit. We're working to enroll between 600 to 800 high-risk pregnancy moms in their third trimester. We're going to support them both prenatally and postpartum. So 4 months are going to be covered by United Healthcare. We're grateful that we were able to secure additional funding through philanthropy from Health Forward Foundation to provide support for an additional 2 months. So moms will receive 6 months of services, and they'll receive access to nutrient-dense foods across grocery categories, including fresh produce, plus 3 telehealth visits with a nutrition coach, a meet and greet, prenatal and postpartum sessions, and then we'll provide educational content, recipes sent via email and text to nudge participants as they go throughout the program. And so one of the things that I think is unique about this project is we have all stakeholders at the table. And it's really meant not only to drive impact for the individual member, but to continue to move the needle on access by gathering the data and insights that are important to policymakers so that we can have a waiver here in Kansas or an in lieu of services option to expand access to populations. So Attane Health, we're the technology platform that's allowing this to scale. We're the direct service provider. United Healthcare obviously is a significant partner in this. They have access to the CanCare members. They provide care coordination with their nurse managers, and all of the patients are connected to United Healthcare. Altruism Media, again, is our CBO, our community-based organization partner that is supporting all of the marketing and patient engagement. And then Health Forward is actively involved as a funder and a partner. And we know evaluation is really important. So we've got third-party evaluation from the Center for Community Health Evaluation, which is a part of Kaiser.
Excellent. That is a huge project that's underway. When's the start date? You're underway now?
Yes.
Okay.
We just started this January.
Excellent. Any other elements you want to add right now?
Well, just it's on the screen, just quickly. Moms will receive a $145 credit that auto-applies in our platform every month. And I want to note that there's a picture here on the phone. It's not an app. It's a web-based platform, and that was an intentional decision because we know that there are broadband access issues. And so although it is web-based, it is mobile first. So we still have about 60% of users accessing the platform on a mobile device, but it is not an app. And that auto credit replies every month. The shipping is delivered direct to their door. And if they go over that credit, they can put in their own debit and credit card and purchase above the credit.
Great. So Emily and Lucia, hold on, and we'll come back to some broader questions here in a moment. We're now going to turn to Charmeka and Donna and give you a chance to give us an overview of the project that you have underway.
Hello again, everyone. My name is Charmeka Martin, representing Healthy Blue. We are new to the state of Kansas, and so our very first step is to come into the market and understand the needs. So similar to what you guys talked about earlier, we recognize that we are not the SMEs in this space and that you guys are. You're working in these communities, you're working with the people in the communities, you're addressing the needs, and you're doing the research. And so by no means does anybody say, hey, let me call my insurance for food, or hey, let me call my insurance for transportation. Although these are things that we do supply and we do support for members, it's not necessarily the top of mind. So the way that we navigate that is by coming into the market and finding out who's the who, and who we need to work with. And so, of course, if you are in Wichita, then you got to know Miss Donna. And so one thing that I learned very quickly about Kansas is that although the state is very big, everyone knows everyone. And so everyone pointed me in this direction. So when we were talking about the needs for food, I called her up and she ran me down the list. She was like, this is what we need. This is who needs it. It needs to be of this quality. And this is the program that there's an opportunity for. We said, you're the expert expert, we're all in, what are next steps? And so I'm going to pass it over to her to kind of tell us about how we got started and what some of the outcomes were for the incredible program.
Well, good afternoon again. I've got them. I think, can you hear me okay? What was the need? Common Ground has been, this is our 10th year with the Mobile Market and Mobile Food Hub. And the organization, the site that you're going to see was our first site that we started in 2014. So we've built relationships over the years with all of our community members. Parents bought the farm in 1968. We're an urban farm in Wichita, Kansas. If anybody knows where Wichita State is, we're 2 miles north of Wichita State on K96. Go to the dead end, we're well hidden. Very few people know about us, but we're gaining some notoriety, I tell you. So our goal is to always see food as medicine. And I was talking to my daughter, Keisha, and I think we always thought that food was medicine. We grew up in that vein. You eat healthy food. Food takes care of you. You take care of your body. So we just that's been our mantra. That's been our underlying method, because our mission is all are fed and no one is hungry. So when we are out in the community with the mobile market, Randy's our program advisor. He lifts loads, and you heard from he and Keisha yesterday. He does all of that planning for the mobile market. We're looking at our end results as how is this food going to impact the people that we're serving. And he asked a question, how many people have we fed today? And what impact has our food on their lives? So that question is always before us. So Charmeka contacted us about Healthy Blue. Yes, we jumped on it because we were in the community. We serve 28 high-rise multipurpose units and senior residences. Okay, well. Let me see. There you go. Just stay right there. So on my left is one of our senior centers with our youth worker. And in the middle of that is the picture at the top. I'm in the white shirt. That's Governor Kelly visiting the farm. At the bottom, we've got a bus that holds 10 seniors. It's a handicap bus. So we can transport seniors. At the top, we practice zero waste on my right. Every Friday, whatever produce we have left over, we gather it up and give it to an organization. And at the bottom, that's during COVID, when our seniors had food boxes, but they didn't have any fresh produce. So we started our Seniors First program and added fresh produce to their boxes. Okay, we can go to the next one. We are a family business. And I thought I was going to skip all of this, but I guess not. So, okay. So we have 3 granddaughters that work with us during the market. We call them the chicks. And when they go to work, they ask, are they on the clock? And yes, they are paid. So it's been a family affair. 2020, we were awarded the first Urban Ag Implementation Project grant. We were one of 7 of the nation. And that kind of validated what we did, what we now do, and just kind of launched us out into this public forum. Since then, we've got community partners, Kansas Health Foundation, Sunflower Foundation, and I want to tell a story about Dr. Berger.
Please do.
We had breakfast in Wichita, several years ago, and she was talking about what I needed to do. And I was telling her, well, Dr. Berger, I'm just not going to do that. And it concerned grants. She said, Donna, you have to do this. And I said, I have to think about it. So she pushed me. And 2021, we received our nonprofit status. We were for-profit. Well, we weren't even for-profit, let me tell you. You know, some of those family organizations, yes. So we got our first UAIP grant, and that launched us into what the validation. And, you know, when you say you've got an UAIP grant, people, oh, well, urban ag. So now we are a part of an urban ag system that's known across the nation. I'm appointed to the Board of Ag by Dr. Kelly, Governor Kelly. I serve with the National Farmers Union Policy Committee. I serve on several boards. But all of this is to bring urban agriculture into the forefront. And now, not only do we serve on those boards, but we are now serving a 12-county corridor from Wichita to Salina, both urban and rural, delivering produce. So we've got our plates full, but it's so rewarding. So this is it. All right. We are where we need to be. So some of the people you'll see in this, hold on, don't go too fast. Some of these people you'll see is, you might recognize, go back down, please, or up. Which way? Up. Up. Right there, in the middle picture with the bus, who do you see?
Keep going.
And I think you were with us that day, weren't you? Yes. They came to visit the farm. We have a 40-acre urban farm. My brother does the farming, and I do take care of all the other things. So we were at Shady Way. And remember, Shady Way was our first site that we visited in 2014. And we came about doing this because my brothers asked me what we could do with the produce they had left over. And I had this wild idea. Let's start a farmer's market. So in the meantime, we had gone to K-State University, who we worked closely with, and the executive director was retiring. And we went to meet with her. And I learned that she had been a master gardener with my mother, and my mother had brought children to the front porch so Bev Dunning could teach them how to sew. So in the process of all of this, Bev is getting her reception party ready, and I'm gonna keep this short. And so my phone is blowing up on Saturday, and somebody says, you need to go to the service station, well, gas station, and get a newspaper. Bev Dunning, I learned what the top of the fold meant. Bev Dunning's gonna retire headline, and then the first sentence was, Donna Pearson McClish is going to open a farmer's market. That was not the plan. It was not the plan. But I said, you threw me under the bus. She said, you'll be fine. So that was the start. So I'm going to go down, and we're going to go down a little bit, and we've got a video. And Charmeka and I talked about the Healthy Blue, but Keisha was the coordinator of Healthy Blue. So she's going to come up and tell you about this video and how she coordinated Healthy Blue.
And while she comes up,
oh my goodness.
While she comes up, I wanted to add that when we were talking through the needs and the opportunities, Keisha proposed a very unique opportunity to not just address food, but to also address mental health and behavioral health and isolation issues that the folks in these high rises were experiencing. So when it came to winter, it was not just the food distribution that made this program a success. It was really the opportunity for engagement and healthy living and healthy activity that spiraled some of the outcomes that you're going to hear about.
I think we already showed the video during the break.
No, this is the other one. It's in the pictures.
Oh, it's in the picture?
Yes.
Keep scrolling down?
Yes.
Okay. Okay. Where?
We love.
I bet this is it. We'll try it. Keep our fingers crossed.
You want me to come over there and look?
All right. Okay. We're just not going to be able to show the video. We're really sorry.
Okay.
I think it's the greatest thing in the world.
Oh, that's
I'm so
the United Way video.
Well, maybe Keisha can just tell us
Yes,
a little bit
he
about
should
it.
just tell us.
So like I had mentioned yesterday, I feel like I'm watching a cartoon.
Great lead-in.
So all of my thoughts have gone out the window. So healthy. I'll wait. See, I told you I wasn't supposed to say anything.
Wow, yes.
All right.
Okay, are we ready?
I think it's the greatest thing in the world. I'm so appreciative of them.
Can we just
Monica Moderna is out at
put the
Common
volume
Ground
down?
Producers and Growers Mobile Market, loading up on fresh vegetables.
I got tomatoes, onions, leek, which I don't know what to do with, but I'll find out.
The only reason she is able to get these fresh foods is because of the grassroots efforts run by Common Ground.
I'm 87, and when you're 87 and you don't get out very much, it's difficult to get all the things you need. You can.
It's okay. Just go ahead and let it run. It's okay. Let's give our technical person a round of
You can
applause.
have your
I wouldn't have been
medicine
able to do
delivered
what he
and stuff,
does.
but you can't have fresh produce delivered. Not very often.
When the people don't have access to healthy food, they do not have a quality of life.
Donna McClish is continuing her family's mission of providing fresh, locally grown, healthy foods for the Wichita community.
My mother was a community advocate, and she would go into the community and ask, what are you going to do when there are no grocery stores in your community? That was back early years. And now we're seeing that come to fruition, that the lack of grocery stores in our food desert and food insecurity areas has increased.
Loaded up in a Chevy van, Donna's team is making sure that seniors, children, and everyone in between have access to fresh food in Wichita and our surrounding communities, mostly in neighborhoods that don't have grocery stores.
So that's where Common Ground, Mobile Market Producers and Growers comes into play. We take locally sourced vegetables and fruits, and we take them to communities that don't have access.
Randy Couts is one of those people you may see driving around town with this mobile market. Working at Common Ground Producers and Growers was the best decision he's ever made.
I've done a lot of things in life, but I've never done anything that literally gives you immediate satisfaction of knowing that what you did for that day makes a difference.
Hello, my name is Aubrey Mentis. I'm the new Community Impact Manager for Health here at United Way of the Plains. We are proud to share that Common Ground Producers and Growers was a recipient of our equity grant, Promise on the Plains.
It's such a blessing and a benefit to know the United Way of the Plains is looking for organizations to pour into, because no one can do it by themselves. The days of Lone Ranger and Rambo are over. Now it is really about collaboration and partnership, and what can we do together to make sure that as many people are supported, taken care of, given access to, based off of partnership. Because it's one thing for one person to have a mission, but it's another thing for a group of people to have a mission and a vision and then carry it out.
Like Randy said, no one can do it all by themselves. This partnership between United Way of the Plains and Common Ground Producers and Growers is one of the ways together we are making this a better community for all.
And this may say it all right here when you hear Monica share.
But I don't really have an access to fresh produce, so this is really great.
We couldn't agree more. This is really great. We can easily recognize the hard work Common Ground puts in and thank them for it.
This is one of my passions. When people come out and sit around like this at the table and they get their fresh vegetables, and we talk about the number of years we've been here and the relationships that we've built, it is phenomenal. It's awesome.
This special coffee loophole took me from
I think
184.
if we can go to maybe some questions so we can make the most of our last few minutes here, and then want to certainly leave it questions for everyone in the room. I think one of the questions is, as payers, Charmeka and Lucia, if you're still with us, and you touched on this, Charmeka, what are you looking for as a payer? What are those elements of a project that attract you, that you can say, yes, this is something that we're willing to invest in?
I think someone said it earlier, like food is common sense. Like we know people need to eat. We know that if certain barriers are not addressed for the population in the community that we're working in, we can't even talk about getting them to the doctor or getting them their prescriptions or anything like that. There are certain things that have to be solved in our communities before we can have those conversations. And so when we talk about the outcomes that we're looking for, someone else said, like, you guys are in control and you guys have the power. That is so true, because you do. People come to you for these needs, and so we come to you for the people. And when you say, hey, partner, this is what I can provide. This is how I track my outcomes. This is how I track what the work we're doing and the value of it in the community. That gives us something to work with. Again, going back to, I'm not the experts. That's why we have folks like Dr. Kofi on our team here. But you guys are. And so when I come and say, I just really want to address food, I need you guys to tell me how to do that. And so I think there's a lot of different ways where we can decide what works and what the outcomes are. And similar to the program that Ms. Donna and I built out, I said, okay, we can do the food, but we have to do something else. And so there's opportunity for us to collaborate together to make the most impact.
Lucia, any additional thoughts you'd like to add?
Yes, absolutely. I think that in this case, one of the things I like to highlight is that we as a payer have great access to data of our membership on outcomes. And Emily and her company have great access to utilization of the service. So together, we're going to be able to measure the actual impact of this type of work. And we are super excited about it. We, as a payer, we are providing food access support. We have been providing that for a long time, but I don't think that we have done just the work that we're about to do, which is providing a little bit of more long-term supports and tie them directly to the outcome and to this very vulnerable population, which is the maternal population. So what are we looking for as a payer? To see babies that have that are not low birth weight, so decrease our low birth rate, decrease our NICU rate, and decrease maternal morbidity, because we know that when our moms access healthy food, they probably will be able to do better in controlling their blood sugars and their hypertension. So my background is in nursing. I'm a nurse, and I studied nutrition a long time ago. So this is for me very exciting, and I'm so excited to have someone like Emily and her company to do this together. So, yeah.
Great, thank you both. Emily, I'll turn to you for a minute. And Alice talked about this earlier. So I think that there's some trepidation maybe as we kind of look forward in the food as medicine space to the role of for-profit and nonprofit organizations helping to kind of complement the work that needs to be done. As an organization that's positioned in that space and one that's gone through transitions, how do you see that industry? And how do you think about the social good versus the economic component?
That's a great question. As someone who has built and scaled a nonprofit and now is building and scaling a socially minded for-profit, I believe we need everybody in the work, but I think our roles may look different. And so I want to highlight again, our strength at Attane Health is that we can provide access to high quality, consistent access to food. Those of you who were here yesterday and heard the challenges that many of the FQHCs were experiencing in their food as medicine pilot of procuring and finding the right foods and how challenging that was with only utilizing the food bank. The food banks do excellent work, but it may be in some cases that they are not the right food provider, but they may have other roles to play. And so for us, we believe deeply that community-based organizations, their strength is their connection to community. And so we're working directly with community-based organizations. Wherever we have a relationship with a payer, we also have deep relationships with community-based organizations where we're able to go in and build those relationships and help build trust for engagement. But we also know that it's really important for this to be sustainable, for it to be at scale. And we think about payer pilots, the size that those payer pilots are. I mean, we're not talking 30, 40 patients. We're talking in some cases, hundreds, thousands of patients as the pilot, and then the need to be able to scale to, tens of thousands of patients for services. So it's important to remember that we've got to build the infrastructure for that. And I think the challenge we have with community-based organizations is also simply tied to just their funding models, right? Like, I remember when I ran a nonprofit, I received grant funding, and I could only use some of that grant funding in certain counties and not other counties. And so we're talking about just financial structure, like the financial structures of business models. And ultimately, if we want this to be sustainable, we have to build models that scale and fit into the way that payers do business. And they do business across geographies, across a wide range of populations. And so you have to have that infrastructure, that scalability, but that doesn't mean that you can't continue to leverage community-based organizations for support. It just may be that their role may look different. And so in our work with United Healthcare, Altruism Media is that community-based organization that we're working directly with. They are working with us in our, every step of the way, from the beginning of our design of our evaluation, our engagement materials. They're at the table. They're helping us really gather that patient and member voice, so that at the end of this project, as we take this data to policymakers, we've captured the voice of all stakeholders, not just that of the payer, not just that of the provider, but we have that patient voice wrapped around all of that data so that it's meaningful and drives outcomes.
Thank you.